Pretty exciting afternoon in the Bay Area. Obviously the Twitter IPO. I think they're right around $46, which is pretty exciting. I don't know if anyone else has an update on that, but that's pretty awesome for San Francisco and just the Bay Area. And we have the Stanford versus Oregon game. Any Oregon Duck fans in the house? Boo! Just kidding. No, it's going to be a great game. And then obviously we have the seminar about compliance and ACA. Isn't that exciting? I know you guys are thinking I'm crazy, but no, it is exciting for us because at Sequoia, whenever you look at change in an industry, there's always opportunity. And when you look at what Sequoia is all about, we strive to be the most admired firm in the industry. And to do so, our goal is to make sure we provide uncommon value to people that come to us with trust. And so this is a perfect opportunity for us to stop and see how we can provide value, educate, invest in our clients and future clients, provide resources, give you extra depth when it comes to your team, because we have a deep team and we're here to really come through for our clients. So that's why we're here today, obviously, is to continue to educate. And in doing so, we have an awesome, awesome team. And when we are in a position where we're working with the best of the best, obviously you guys, and working with the best companies, we have to have the best of the best teammates. And so I'm privileged to announce and introduce two of our speakers today. First is going to be our ERISA attorney, Peter, and then Annie on the compliance director side. And Peter got his degree from Bradley University, got a BA and graduated cum laude, and also got his MA from Bradley as well, and graduated summa cum laude, and then got his law degree from University of Illinois College of Law, and graduated magna cum laude. So pretty awesome history when it comes to education. And I think most importantly for him and you guys is that 4 years before he got started practicing law, he was an HR director. And so he sat in your seats, so he knows the HR side from your perspective, and then also from a unique perspective where he sits today. And he's got a pretty awesome rap sheet, so I'm going to kind of roll through it real quick. And there's so many things I had to look at my phone and cheat a little bit, but and you'll understand when he gets up here and starts talking. We had an awesome session this morning, but best lawyers in America, he was recognized from 2006 through 2012. Massachusetts Super Lawyers 2011 through 2013. Part of the US Legal 500, and Boston's Best Lawyers of 2010. And so for us, that's really powerful because we want to make sure that we're providing you the best of the best when it comes to our team. So with that, I know that he lives in Boston, has 5 kids, and I know that for me, having 3 kids, I wish I had a law degree sometimes where I can help raise my kids a little better, but I know it's provided useful at your home, and we're pleased to have him today, so I'm going to bring him up and have him go through the first part of our presentation. So welcome, Peter.
Thanks, Steve. I don't know what all that Latin means anymore, by the way. I also, since, at least for the undergraduate and graduate degrees, since I don't remember any of it, I can't imagine how I got those grades, which was a sign of the times. Those of you who are older like I am know what I'm talking about. Okay, let's jump right in. I want to start, we're going to get to the Affordable Care Act, but the Windsor decision is really something we should spend a little bit of time with because it's something you should be focused on right now. And what I'm finding with my clients, and I work with clients across the country, is that they're really not focused on it in a way that they should be. There's a lot of moving parts here to consider with respect to your benefit plans and also with respect to your employment issues. I'm not an employment lawyer, but there's a big impact on the employment side of things. So what are we talking about here? Well, back in June, in a 5-4 decision, the United States Supreme Court ruled in a case called U.S. v. Windsor that Section 3 of the Defense of Marriage Act is unconstitutional. Defense of Marriage Act was passed back in the early 90s, signed into law by President Clinton, and it basically says in a couple of different places, but Section 3 anyway says that for federal law purposes, a spouse can only ever be defined as the opposite sex married partner of an individual. Okay? So under federal law, and understand that most statutes that use the word spouse do not define the term spouse. Okay? So there's an actual part of federal law. It's a list of definitions. So if a term is used and it's not specifically defined in a piece of legislation that becomes a statute, it refers back to this long section that lists all of these definitions. So specifically, any law that used the term spouse was limited, and the federal regulators could not go beyond that. It's interesting because it was passed at a time when no jurisdiction in the U.S. recognized same-sex marriage. Now, we had domestic partnerships, we had civil unions, we had things like the Civil Union Registry here in California. We had those types of relationships across the country, but at that time when DOMA was passed, we really did not have any jurisdiction in the United States that recognized same-sex marriage. Section 3, by the way, of DOMA allows states to refuse to recognize same-sex marriages performed in another state. The Supreme Court did not have that issue in front of them with Windsor. Windsor's an interesting case. It involves a couple who lived up in Canada. They were married in Canada, and then they relocated to New York. New York at the time did not recognize same-sex marriage, but it recognized any marriage that was performed in a jurisdiction in which the marriage was legal. That was right after 2004 when Massachusetts made same-sex marriage legal by court decision. So this couple, fairly well-to-do, one of the couples dies, and the remaining spouse makes a claim for the spousal exception, okay, under the estate tax rules. And the IRS said that it wasn't available to her because they weren't married in the eyes of the IRS. That's the only issue that went up to the Supreme Court, was whether or not Section 3 of DOMA was constitutional. And what the Windsor Court found, and frankly, to be honest with you, the reasoning is a bit results-oriented. Meaning, I think that 5 members of the court decided that it was just wrong that people would be treated differently, and they used a little mix of equal protection and states' rights to get there. Okay? They didn't touch Section 2, and they dropped a footnote saying we don't touch it. Most people who understand the Constitution think that Section 2 is actually the one more ripe for a very clear decision that it's unconstitutional, because the Constitution itself requires the states to recognize the laws. It's called comity, to give comity to the other states. Otherwise, we'd have chaos and we would not have a union. Okay? So this is probably the next one to fall. Okay? Now, I'm just predicting for you. That case is not anywhere near the Supreme Court yet. The reason I dwell on it is I'm going to talk to you in a minute about what the federal agencies have done to address the fact that Section 2 wasn't addressed. Okay, so today, 10 years after Massachusetts, today it's actually 15 states. In New Jersey a couple of weeks ago, a mid-level court, state court, ruled that New Jersey's ban on same-sex marriage was unconstitutional. New Jersey's Supreme Court refused to hear that case on appeal, which means that is now the law of New Jersey. And then just the other day, the state legislature in Springfield, Illinois, sent to the governor for signature a law recognizing same-sex marriage. So those are the 14th and 15th states. And we'll see more of them, I think, come online here. And if this ever goes up to the Supreme Court, this may well mean that even more states will say, we're not going to get into not recognizing another state. We're going to change our law. Importantly, Windsor does not require you to employers in states that do not recognize same-sex marriage to recognize same-sex marriage, okay? And the reason I mention that is that we have employers across the country that really don't go any further than they have to, which is interesting because on this issue, this is one where the courts and the states have lagged behind employers all the time. Employers were offering same-sex benefits long before it became an issue in the states. Okay, so we don't have a lot of employers out there that don't want to do it, but it's important to know that the states don't require it because it sets up all of these questions under that other section of DOMA that we need to be aware of. The main question is illustrated in the following fact pattern. Here's the question, okay? You have a couple who is married in Iowa, a state that recognizes same-sex marriage, okay? So they're legally married. They are recruited and moved to Michigan by an employer, okay? And they go to Michigan and the employer says, well, we're going to offer your spouse coverage just like we would have if you were in Iowa, okay? So the question is, that couple now lives in Michigan, a state that doesn't recognize same-sex marriage. For federal tax law purposes, which state law do you apply? And all of the agencies, from the Department of Defense to the Internal Revenue Service to Immigration to Homeland Security, all of the federal agencies have now come on board through direction of the President with this rule of celebration, okay? And what that says is, for federal tax law purposes, disregard state law and look at the state where the marriage was performed. And if it was legal in the state that it was performed, it's legal regardless of what the state says. So in Michigan, that couple will be treated as married for benefits purposes. What's the issue here? For our purposes with health insurance plans, it really comes down to taxation. I mean, even the Windsor case itself was a taxation case. I mean, that at the end of the day, we're talking about a benefit that married couples enjoy that the federal government refused to provide to same-sex married couples. The rule of celebration says that in our case, where the couple was legally married in Iowa and moves to Michigan, if the employer provides the benefit, it's in a state that does not recognize same-sex marriage. What happens with that benefit is that for state law purposes, you have to impute the value of the benefit into the employee's income. But for federal law purposes, you don't. As long as the rule of celebration applies, they were married in a state that recognizes same-sex marriage. Okay? And I should have told you this up front. If you have questions as we go along, please go ahead and ask them. That's a better way for us to get to this stuff. So any questions on any of this? This is all fairly straightforward, right? Yes?
I have one quick question. Do you think that it will actually cause employers or even insurers to stop offering domestic partner in states that it is legal?
So let me repeat the question. The question is, do I think that it will cause employers or insurers to stop offering domestic partner coverage? I can tell you that I don't even think it, I know it. Okay? I practice primarily in Massachusetts, and after the Goodrich decision, which legalized same-sex marriage in Massachusetts, the carriers reached out to our community, the benefits lawyers community, and they said, this is what we're thinking about this. What do you think? And what they said to us was, we're not comfortable anymore allowing employers to offer domestic partner coverage only to same-sex couples. Okay? And the reason, and we said, yeah, we agree with you, we're not comfortable either. And the reason why we weren't comfortable in Massachusetts, and we're not comfortable today with it, is that prior to it becoming legal in Massachusetts, the justification for treating same-sex domestic partners differently from opposite-sex domestic partners, right? People living together of opposite genders, is because the same-sex couple couldn't legalize their union. The opposite sex could run down to the courthouse, run down to the church, do whatever, make that legal, and then get the benefit. So we said, we're going to treat you differently. The minute the law changed, and this is a concern for you all in California, now that it's clear what the California law is, you could be faced with a lawsuit by a heterosexual couple, right? If you're offering same-sex domestic partner coverage only, they could claim you're discriminating against them because there's no basis for that distinction. So what we find in places like Massachusetts, New York, New Hampshire, Vermont, where this law has been around for a while, employers and carriers are going one direction or another, or maybe both. Either no domestic partner coverage at all, or we offer domestic partner and we don't care, what the person's gender is. So we are seeing that. And that should be, again, if you haven't focused on that, given, California, we finally know what the answer is in California, you may well want to think about that. Any other questions? Okay, so keep in mind all of these types of plans are governed by federal law. So regardless of where you're operating, and look, if you only operate in California, it's pretty clear. That's the law in California. Now we recognize same-sex marriage. But keep in mind all of these different types of plans. This is now the rule, and the state law doesn't matter. What matters is the rule of celebration. Retirement plans have to have some special care taken with them, okay? The first thing you need to do, I'm going to go here for a minute, is to look at your plan documents in your SBDs. Have them reviewed by your ERISA counsel, okay? Now, we did this. I represent a bunch of clients across the country, and I said to the lawyers who work for me, I want you to take a look at our plan documents and see if they need to be amended. I'm pretty sure we won't have to touch them. Boy, was I wrong. In almost every case, we had some SPD or some plan document on the retirement plan side that said, for these purposes, your spouse is defined as your opposite sex married partner. Why? Because that's what federal law said. And they were written to make sure there was no confusion between state and federal law. All of those documents need to be rewritten, okay? Because they now violate federal law. Your retirement plans are governed solely by federal law. California, even if it wanted to, couldn't write a rule to affect your 401k plan. It would not survive preemption, okay? So this is a federal law, so you want to check those plans. And then consider, we have a very big client with a very big frozen pension plan. And it has gazillions of dollars in it, okay? Not really. A little less than what Twitter will make today, probably. By the way, how many of you are getting in on that? You and Ashton Kutcher, if I hear one more report about Ashton Kutcher's investments, I don't care. He will always be the goofy kid from that 70s show to me. I don't care what else he does. Anyway, gazillions of dollars. Here's an impact that I hadn't been thinking about. It came up in the last couple of days. A lot of the actuarial valuations in that plan are now going to be redone by our actuaries to see if any of our assumptions change. We don't think so. But we never factored in the demographic. We never factored it out, we don't think, but we're not sure, of a sizable population potentially of same-sex married couples. Now, the actuary thinks that they've only ever kind of assumed marital status, and so we should be okay, but we can't assume that because it has an impact on the funding. Okay? So there are all kinds of tentacles here that if you're not focused on it, if you're thinking, oh, okay, that's no big deal, I would say to you that it's a very big deal. Spousal benefits and rights, if you have a 401k plan and I have a same-sex partner and you don't realize I have a same-sex partner and I go in and change my designation to my sister, there's a chance, if the plan is drafted that way, that I need to get a spousal consent from that same-sex partner. So there's all kinds of communications you need to think about here. Okay? Any questions before I move on with this?
Going back to that earlier question about moving from one state to another,
Yeah.
what happens if the employee is an international employee cutting into the United States?
Well, again, the question is, what about international employees? It's the same rule of celebration. So if they live in Sweden, recognize the same-sex marriage, and they're married in Sweden and they move to Nebraska or some other state, the rule of celebration would say because that marriage was performed in a jurisdiction that recognizes it, for purposes of federal law, it'll be recognized. Okay? Any other questions? Final point, again, I don't think that, in San Francisco particularly, we have to worry about dwelling on this stuff too much because you're more sensitized to this. Frankly, it's a more liberal community and you understand these things better than, say, if I was talking in Jefferson, Missouri. And I'm not picking on if you're from there. I'm just drawing a contrast, right? Do not require of your same-sex married partners any documentation that you do not already require of your opposite sex married couples. Number one, fundamentally that's wrong, that you don't want to treat people differently. It's also illegal, okay? So, and I get that question all the time. You know? So what somebody asked me, you know, what do you think about this? I said, well, let me ask you a question. I've been married 27 years. I don't even know if we have a marriage certificate or license somewhere. I don't know where it is. My wife might know, but I doubt it. You know, after 5 kids, she don't worry about the detailed stuff like that, you know. So, again, don't impose greater restrictions. No final questions? Okay, we'll move on. The Affordable Care Act. We don't have time today to spend a lot of time reviewing all of the rules, but I'll certainly take your questions as we go along. We'll level set on some of the rules, but only as a means of then talking about some strategies, all right? And when I talk about strategies here, one thing that you should know that kind of separates me from a lot of the lawyers doing this across the country, I've been practicing in Massachusetts since 2006, where we have mass universal health care, okay? The two laws are very different. They share this kind of connectivity. But beyond that, the details are very different. But what they also share is the introduction of a governmental body into an area of employment business that they really have not been a part of. Okay? In terms of compliance review, since ERISA, you all know this, you are more likely to have your 401k plan audited than your welfare plan audited. Okay? You've probably noticed over the last couple of years that's shifting a little bit. The agencies are starting to audit a lot more. Okay? Andy's got an interesting slide on that she'll show you later about what they're doing generally. Okay? What you need to know is, based on my experience in Massachusetts, is that there is going to be, between you and the federal government and you and the state government in California about your welfare plans, a real heightened kind of interaction with those agencies. And anytime that happens, that means you're going to have to devote more resources, time and money, right? Because they will demand it of you. All right, so that's just an overall observation. As we go along, I'll tell you about things that I think you should be thinking about, not because they've happened yet on the federal level, but because they've happened in Massachusetts. So they're based on our experience. The law was passed, the Affordable Care Act was passed. Its two major premises were what? Access and affordability, right? Everybody agree to that? Access in this country, our friends here at Sequoia will tell you this is true. If you are a small business owner in this country, or an individual in this country, access to affordable insurance is almost impossible in some cases. You know, the examples are legion of small businesses where the owner decides he's not going to be insured because he's got diabetes or something, and it'll make it too expensive for his employees to get it. So he goes without insurance so that he can deliver lower rate insurance, right? Used to happen all the time, okay? Individuals can't get insurance at any dollar number, okay? Not, much less something that would be affordable to them, okay? On the other end of the spectrum, right, we have things like lifetime limits and annual limits that were in place prior to 2010 that worked to cut off insurance. And then we had a whole segment of society that didn't want to get insured, okay? When you add all of those up and then you just add in the people who don't believe in insurance, and there are many who don't, okay? My son, my youngest son, who I obviously love him to death, but he's told me repeatedly, you know, I have no use for carbon units. You know what a carbon unit is? People. Okay? He's all numbers. He's all about numbers. He's joking, of course, but okay. He looks at everything cynically and he says, you know, insurance, it's an interesting bet. You're betting against yourself and the insurance company's betting on you. So why would I take that bet? Like, why am I having this conversation with you? Yeah, it's not an option for you. You're not opting out of our insurance. But those are the kind of conversations that I have with him. You should be happy he didn't go to Caltech. You'd be putting up with him in a few years. He's going to stay around Massachusetts. Okay. Adding all those groups up, when the law passed in 2010, what percentage of people here legally, okay, because that's what the law addresses, do you think didn't have insurance? What percentages did you hear? Anybody? Come on, take a guess. 50%. Okay. Any other numbers? 15. Okay, 15 to 50. Now, think about that for a minute. All right. Half, if you in a room in 2010 with 100 people, that would mean 50 people would not have insurance. Or if you had 10 people, 5 wouldn't. I think intuitively, when you stop and think about it, well, that's probably not right, right? Because many people, in fact, the majority of people in this country get insurance from their employers, okay? When you get up to about the 50%, if that's what you heard, or 35 or 40 or 50%, those numbers reflect people on Medicare, Medicaid, TRICARE, which is military insurance, and other forms of government insurance, okay? But those people are insured. When you back all of that out, it's really closer to the 10 or 15% mark, okay? Which, when you have 350 million people, is still a lot of people, okay? And if they don't have insurance, that's driving cost up. So the access of this is designed to give individuals and small business owners the access so that if they get hit by a bus and go to an emergency room, we all don't end up paying for it anyway, okay? So that's the access component. And by the way, a third of that group, depending on who you read and who you believe, and I kind of believe this statistic, is between the ages of 20 and 30. Think of my son. Insurance is a bad bet. Why would I pay for insurance? It's also an age where people think they're immortal, right? They do things like tie rubber bands around their ankles and jump off bridges for no apparent reason, okay? Like my oldest nephew, who does it every year and invites me, okay? And every year I say, no thanks, Greg. And this last year, he said, come on, we're going to do it naked. Come on, Uncle Peter. Oh, well, there you go. That makes all the difference in the world. The law gives coverage to age 26. Very low-cost way to approach that segment of that access. In fact, many people believe, and I'm one of them, that because they based that provision on the mass law, they shot too low. Do you know the oldest age that insurers are required to insure kids today in the United States? Anybody know? 26 is the federal law. You know Snooki. Snooki? If Snooki celebrates her 30th birthday on her parents' plan in New Jersey, she can stay on it until she's 31. That's the law in New Jersey. Now, I know for some of you, particularly those of my vintage, I graduated high school, I am not making this up. My dad, I can remember clearly that June night, pulling me in for a hug saying, congratulations, good luck, let us know how it works out. That was it. Literally it, okay? It's not like that today, no. Underemployment, unemployment, kids keep staying in the house. If I had been asked, I would have said, go, not quite to New Jersey, but Florida, it's 29, New York, it's 29. It's a realization that there's a group there that we could insure relatively cheaply. And it's a group that needs insurance, okay? So, and I mention that only because, you know, that's a very positive part of the law, but it's a part of the law that could be improved upon. And the states know this, and there are states looking at, you know, the New Jersey model saying, well, can we do even a little bit more, okay? So that's the access part of it. How do we do that? We do that with individuals, employers, insurers, changing the rules. So with respect, and there's always the carrot and the stick, okay, with the law. Now with the individuals, it's truly the carrot and the stick. The stick is the penalty. The penalties are not great. We don't expect them to drive too much behavior. And they're also, you don't have to pay $95 if you don't have insurance. You don't have to pay $95. You just don't get $95 back from your refund check at the end of the year. Okay? So if you don't file a refund, and do you have a lot of employees who don't file for a refund? You do, more than you know. Some people, it amazes me, but because they're only getting back $100 or $200, they don't want to take the time to do it. All right? We don't see this as motivating much behavior. 2016, the numbers start to go up a little bit. You might see that. So as an employer, as you're looking at your plan design and thinking about who's going to take your insurance, know that at some point this stick might start to kick in, but initially we don't really expect, and we've not seen that in Massachusetts, by the way. The penalty is not a big driver for people getting insurance. What's the big driver? The big driver is the money spent by the state educating people that there's an opportunity to get insurance, okay? And it's out there, and it's a responsible thing to do. And the day I landed, I think I heard 4 different commercials, radio and TV, for Covered California, all right? And I thought, that's what you have to do. You don't just throw a product out there and expect people to find it. You go out there and you tell them about it. So I think more than the penalties, it's going to be the state's efforts. What's the carrot? The carrot are these premium subsidies that are available, okay? Now, what's the rule on the premium subsidies? It's 2-part. One, they have to fall between 133% and 400% of the federal poverty level. Okay? And they cannot have access to affordable coverage from you. If you offer them affordable coverage and they're at 150% of the poverty level, what's their subsidy from the federal government? 0. Okay? So 2 things have to be true. They have to fall in this range, and then this is the max that they're going to pay of their combined household income for insurance. I'll show you some numbers in a minute. But only if you don't offer them affordable coverage. If you offer them affordable coverage, they're not eligible for any of this. What happens at below 133%? This is the Medicaid expansion part of the Affordable Care Act. The Affordable Care Act, as written, said states have to offer a new component of Medicaid, expanded Medicaid, for those making 133% of the federal poverty level or below. In other words, and this is the term they use in Washington, I'm not a fan of it, but they do use it, the working poor have access to virtually free care. Now, if you don't offer affordable coverage and your employees get this subsidy, that's what trips the penalty against you. If they go in and get the Medicaid coverage, the penalty is not tripped. It's just a part of the law. It doesn't trip the penalty. So the Supreme Court last year said, no, you can't do that, federal government. You got to make it optional. So the blue states, which is now up to 24, both Tennessee and Michigan are now blue on this, are all states that are taking the Medicaid expansion, okay? That means in those states, and for example, California, Nevada, and Oregon, for people making less than 133% of the federal poverty level, they have access in California, right, to Medi-Cal. And if they get that, that does not trip the penalty for you, something you need to know and keep in mind. It's part of your strategy in dealing with healthcare as we go forward. What's going to happen in these states? Some of these states will never change their mind. Okay? They just won't. I don't see Texas changing anytime soon. All right? Some of these states, they're going to be under pressure from the employers in those states to say, what are you doing? You're leaving federal dollars on the table. And my expectation is that a year from now we'll be up to 35. And that's just a number I'm plucking out of thin air. And it'll go up. We'll never be at 50 because you'll always have these states that just won't do something like this. But we will see more of it. What's the point for all of you? If you have a multi-state operation and you're trying to figure out your strategy for dealing with the Affordable Care provisions, the pay-or-play provisions of the Affordable Care Act, get to know this map because it will make an impact on the decisions you make on how you structure it. This will come clear in a minute when I draw it all together. So what does all this mean? Okay? What does all this mean? This means that if I work for you and I'm a single person and I make $25,000 a year and you don't offer me affordable care, right? Then I can, and I live in the San Jose area, this is all done by zip code, then I could go on to Covered California, get a silver plan which reimburses at 70% of my costs, and pay no more than $144 a month. The way the subsidies run, if I'm a single mother with a child or a single father with a child, 2 people in the family, husband and wife, silver plan, $94 a month. You cannot match those rates. You can if you're going to pay more for your employees, but many of you, because of the balance sheet issues that you have, won't be able to match these rates. You need to know this is your competition. Okay? And you also need to understand that if you're offering affordable coverage to these people, they don't have access to these rates. You all with me? And of course in California, because we have the Medicaid expansion, at $30,000 a year with a family of 4, they're getting free care. It's a husband and wife and 2 kids or some combination of that. All right, need to know that stuff. What's going on with the exchanges? Of course, we have covered California. In Massachusetts, we call it the connector. Federal law says set up an exchange. If you don't, the feds will set it up for you. Not surprisingly, the states that have undertaken their own exchanges or marketplaces are well ahead of the federal government. Okay? And I say not surprisingly because you have a group of people who are working together to create something. In these states, do you think you have a group of people working together to create something? These states have already basically told the federal government, we want no part of this. All right? We already know that, right? So the idea that these states have been actively working with HHS to set up these exchanges in their states doesn't make sense. And I can tell you, based on discussions I've had with folks in various parts of the country, there's not a lot of communication going on between the federal government and the people in South Dakota or Nebraska or Kansas about this. So these technical glitches that we've been seeing is really just the tip of the iceberg in those federal exchange states. Because behind those technical glitches is really, from the heat of the night, a real failure to communicate. Well, not heat of the night. What am I thinking of? A real failure to communicate. What movie am I thinking? Anybody know? Cool Hand Luke. Thank you. I knew it was a movie I liked. So we have October 1 sign up. We had all of the glitches. And we had, everybody, congressional hearings and, calling people up and demanding what went wrong. You know what that said to me? That says to me that we elect people to go to Washington who have never really worked for a living. Right? And why do I say that? How many of you have been through some kind of an HRIS or similar conversion? Have you ever seen any one of those go off without a hitch? Perfect day one? Of course not. So you're going to roll out this high-tech portal across 35 states, and day one it's supposed to be perfect? Only in Congress would they have that expectation and then act, and this one I do know, like the end of Casablanca, shocked that this would happen. They'll work out these bugs. What they won't work out very quickly are these communications issues with these states. And that's going to be something you'll need to track if you've got a multi-state operation. Okay? But they will work this stuff out. What's happening? Now, again, these slides are as of 10/13. Okay? No, we don't have millions of people flooding to the exchanges. Okay? We had, in the first 2 weeks, about 40,000 New Yorkers sign up. Now, it takes a little bit for them to get enrolled, so these aren't enrollment numbers. And at the same time, about 28,000 Californians. I think this number is probably about double today. I don't know. Couldn't find any statistics I thought were reliable. Okay? And just to level set here, if it's on MSNBC or Fox News, then I just discount it completely from either side of the spectrum. That's my view. It's got to be somebody who's actually doing it, right? Here again is another failure in Washington to understand what we all know. What happens with open enrollment for you? Does everybody sign up the first day? Everybody get their paperwork in? Yes, this is what I'm doing. very clearly checking the box? No. Everybody does what I do, and you do probably, right? They throw it on the desk, they say, I'll think about that tomorrow. And then tomorrow comes when somebody says, you know, open enrollment ends tomorrow, and you're not going to have X if you don't do it. And then you get the flood that comes in. I would expect, now keep in mind, open enrollment in the first year goes through the end of March, or through March. Okay, not the end of March, but through March. So these numbers are going to jump up dramatically. I would expect California to continue doing what it's doing, I think correctly. Advertising to people, letting them know the product is out there. They will probably drive that even harder as we get into February. Okay? And you'll start to see some significant numbers. Now, will you see 10, 15 million Americans signing up for this? No, but keep in mind, you know, they have other alternatives. They have their spouses' plans. They have their parents' plans. Okay? So that can't be the target number. At the end of the day, off to a slow start. Anybody who wants to just declare this a complete disaster, you know, good luck to them. It's too early. And I don't think it's a disaster. And I think for folks who live in a state, you don't appreciate it. I look at all of the states' websites and what's there. And California is, you know, it's not surprising, but by far and away better than a lot of the states. Nevada does a good job. Massachusetts, frankly, is miserable. You think after 7 years we would figure out how to come up with a website that looks like California's? Okay? We're just not as smart as you guys. We have better baseball team. That's all that counts, dear. Okay. All right. Employer insurance mandates. Any question in the exchanges? Again, I try to frame it from employer's perspective. Know what the exchanges are doing because some of your folks may be going there depending on your strategy. And know, and again, I can't stress this enough. I don't care about people's, this is the law. It's not politics. All right? Discount everything you're hearing from either side. It's not all rosy like Jay Carney would tell you it is. Okay? But it's not half as bad as what the other side would say it is. It is what it is. It's a rollout of a big federal program, and they'll get there, or a big state program, and they're getting there. Okay. For you as employers, what do you have to do? A lot of new reporting, disclosure, and other requirements. I want to dwell on this for just a second. This is extremely important. This comes straight from our experience in Massachusetts. This is a law that requires you to keep track of everything. Hours worked, coverage offered, employees who come in and out, all kinds of data about employees and their families. And my experience in Massachusetts is that if you don't have the records in a shape that the regulators want it, you could end up paying a penalty just because you can't show it to them in a way they want to see it. And that happens over and over again in Massachusetts. Okay? In Massachusetts, and this is not unlike any other regulator, they run by what I like to call Shannon's rules. Do you know Shannon's rules? No, none of you grew up in my neighborhood. Okay? In my neighborhood, right, the Shannons were the biggest family. 10 boys and 4 girls. Okay? Every sporting thing that we did was done at to call it Shannon's yard was laughable. There was no yard left. There wasn't a bit of yard left. Today they have a beautiful lawn. Okay? All the kids are grown and gone. What were Shannon's rules? Well, I'll illustrate and then you'll get it. Whether or not a ball hit today is fair or foul depends not on whether it was fair or foul yesterday, but only on where the first Shannon hit that ball. If it was that side of the tree today, then it's fair today. Yesterday it might have been foul. Do you get my point? Shannon's rule